They'll puff it like 30, 40 times, like 10 times, 3 times. You know, they're like puff, 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 and as they inhale it, they take too much of the medication, developing a condition called tachyphylaxis, where instead of being prophylactic, you know, and preventative, you're actually developing an immunity to that medication. So now the person who has asthma could be treated with regular albuterol, now has status asthmaticus, and they need a higher dose of albuterol concentration, higher than 2.5 milligrams, or maybe a steroid with it, you know, to help reduce the site of inflammation. Somebody that has asthma has a very life-threatening disease, but they develop a tolerance to a certain medication like albuterol because they were abusing it. There were patients coming up to me and says, well, I use it when I'm out of breath. Why would you use it when you're out of breath? You mean everyone who gets out of breath needs to use albuterol? Well, my doctor says use it when I'm out of breath. I said, are you wheezing? No, I'm not wheezing. It's like, so then why are you taking it when you're out of breath? Well, I thought I was supposed to take it when I'm out of breath. I said, you're saying anytime you get up and you have a little heightening of work of breathing, you take the albuterol treatment. But you're not wheezing. Albuterol doesn't fix out of breath. It never does. It can't. What causes the trigger of feeling out of breath? CO2. So how in the heck can albuterol take away CO2? It can't. It's a beta-2 specific drug. Kind of non-specific because it's not like a LAMA, like a long-acting muscarinic antagonist. It's a short-acting, it's a rescue inhaler. And all it's meant to do is dilate your airways. It's a beta-2 specific drug. So you can't use it when you're short of breath. It makes no sense. Because albuterol is a bronchodilator. Bronchodilator, not a CO2 eliminator. You know, so it doesn't do anything for shortness of breath. Yeah, I mean, if your doctor says use it when you're out of breath, go ahead. But I'm telling you, it's not an out of breath machine. It's not. It makes no sense. Now, maybe when a doctor is saying, you know, use it when you're out of breath, they're thinking you're wheezing. Use it when you're wheezing, never when you're out of breath. What's the point? Maybe it's a placebo. Maybe you like it like that. Maybe that's different. But albuterol is a bronchodilator, not a CO2 eliminator. You know, out of breath is caused by CO2. Oxygen, like low oxygen, doesn't cause out of breath. It's a very, very poor trigger for feeling out of breath. So when somebody feels out of breath, what happens is, like, let's say there's not enough CO2 coming out, which is always the case. So if there's not a lot of CO2, just understand a little bit of a chemistry. If CO2 climbs and the overall total value, let's look at the pH, which defines the acidity and alkalinity, neutral, you know, it just depends on the overall quantity. You know, so let's look at the pH value. Well, if CO2 is supposed to be around 35 to 45 millimeter, which is true, 35 to 45, and let's say it hikes up to 50, then the pH is going to start to go down. Okay? That's because it's becoming more acidic. You add more carbon, you know, you're adding more carbon, you're increasing acidity, not alkalinity. Okay? So the medication wouldn't do that, right? Of course not. Can you be out of breath because you're out of shape? Yes. Can you be out of breath because you have high anxiety? Of course. You know, it's just the way it works. But controlling out of breath with a rescue inhaler it makes no sense because it doesn't take away CO2. It open up your airways. You know, it can open up your airways to release more CO2, make it more that effective. That works. You know, especially when you're inflamed. But let's say you're out of breath, but you're not wheezing. Then you're like everybody else in this world. Out of breath is caused by CO2. Oxygen is a poor regulator, you know, so it's a very poor regulator. Like for instance, Let's say you have an athlete. He's running up a hill. Oxygen looks like 96, but the heart rate's 145 beats per minute. The person is 40 years old, let's say. Okay, the person's out of breath, but their oxygen is all the way up high. But how are they feeling out of breath? My point is, oxygen doesn't cause out of breath. There is no drug that gets rid of CO2. It's opening up your airways, breathe.